incidence of breast cancer is tremendously high.
So I call breast cancer the new diabetes.
She came to me with a breast lump. I, in fact, had fingers crossed. I just wanted it to be some fibroadenoma or cystic bleeding.
Breast cancer numbers are definitely on the increasing side, and the risk for breast cancer in India is 1 in 20 to 24. Average age of breast cancer women that I diagnose and treat is 35. And we have more and more number of triple negative breast cancers. Don't sit with it by listening to neighboring auntie or your grandmother, because according to them, everything is a milk cyst. It is not so. Breast cancer survival rates have improved significantly if we treat completely.
Imagine post-delivered mothers with real milk duct block and a lump. You should imagine their panic.
Yeah, for breast cancer.
Is there any time that we're going to have a breast cancer vaccine?
I wish, ma'am, but I don't think it's happening in the near future.
We advise them at the right time. They never take action at that time. They have all worldly priorities to take care of. Other than them, I either talk to patients, either deliver babies, I do laparoscopic surgeries, I do robotic surgeries. We are in a super specialty hospital where we have day in and day out risky patients. Welcome to the first episode of Simply Shilpi. And this is my podcast and my passion to get closer to you people. So welcome aboard. And here is one of my favorite surgeons, Dr. Ramya.
Hello, ma'am.
And Dr. Ramya is a renowned breast surgeon. She's a breast and endocrine surgeon, a very rare combination that people usually don't get to know. And I have the luxury of her in my team. And today we wanted to take you forward through a good podcast with her, because it's two women talking about everything under the sky. So there would be no edits, there would be no censoring, and it'll be a direct face-to-face talk.
I'm so excited. Congratulations, ma'am, on Simply Shilpi. I'm very excited and looking forward for a great conversation.
Welcome, Ramya.
Thank you, ma'am.
I want you to introduce yourself.
I'm Dr. Ramya. So I'm a breast and endocrine surgeon, as ma'am has just introduced. With a lot of passion, I've pursued this degree of breast oncology and endocrine surgery. Being a female and with the rising number of breast cancers, it's the need of the hour and day, especially in a country like India, where there is a well-trained female surgeon who's confident and who can guide patients. So not only breast, I also operate on thyroid and parathyroid. These are rare diseases, and especially parathyroid, many surgeons do not know how to go about these surgeries. So I've trained from very good institutes, and I'm lucky to be associated with KIMS, especially with senior colleagues and energetic colleagues like Dr. Shilpi, who has been encouraging from day one. And we're almost like friends. Though we are very busy in our schedules, we get to talk to her every day, and I'm very excited for this conversation.
And I want you to tell about your Insta page and your work that you're doing online, so that all our viewers will follow you.
So you can follow me on Dr. Ramya Valiveru on Instagram. I have a Facebook page as well as a YouTube channel. That is again Dr. Ramya Valiveru. You can follow me there, and you can get exciting, updated information on breast cancer, thyroid, and many other things like the exercises and weight loss journey that I have started.
So, Ramya, let's deep dive into the subject.
Yes.
And these days, women are so busy, and they would want some instant things for their health and well-being, especially breast health. And we all know very well that the incidence of breast cancer is tremendously high.
Yes.
The reason being lifestyle, so many changes. I want you to give a very good message, a precise one, to all the women watching us, how they can take care of their breast health, and some tips about their, how to go forward with screening, and what they should, bare minimum that they should do.
They should know. Yeah. So as ma'am rightly pointed out, breast cancer numbers are definitely on the increasing side, and the risk for breast cancer in India is 1 in 20 to 24. So the need of the hour is to first understand what are the risk factors, and the second thing is how to know if there's a cancer early or not, right? So the risk factors definitely, the number one is our lifestyle changes. So we've become more and more sedentary, and we don't exercise, we eat processed food, and the age for first pregnancy has increased. We are not feeding our kids once we deliver them. We also have rising obesity. So I call breast cancer the new diabetes. So in my presentations, I actually say it. So the risk factors for breast cancer and diabetes are common, and both of these numbers are increasing. Not only these, there could be a family history of breast cancer, and especially in India, we have young people who are being diagnosed with breast cancer. That one we have to remember. Western countries like the US or UK, the average age for breast cancer is around 50 to 60. But in India, the place where I practice, that is Kondapur in Hyderabad, average age of breast cancer woman that I diagnose and treat is 35. And we have more and more number of triple negative breast cancers. And so many times what I've noticed is because of lack of awareness, not only among the patients, even among the doctors in periphery, they are being treated like benign diseases because they have not seen or heard or read about breast cancer being there in young women.
And in fact, we had a very young woman walking with breast cancer today.
Yes.
She was my patient, and she's less
just 29.
than, less than 30 years. And she has a very gross lesion of more than 3 centimeters of size.
Yes. And so that is one thing that I want to highlight. How to identify breast cancer. So there are a few signs and symptoms. Patient can do breast self-examination. The person can do breast self-examination. If you are premenopausal, that is you have regular periods, you can check your breasts on 10 days after your periods because breasts are softest at that time. If you have irregular periods or if you're postmenopausal or if you're a man, you can check it on a fixed day of every month.
It means men also need to check.
Yes. Point well caught. And the examination is a very simple, straightforward thing. There are 2 steps. One is inspection and the other is palpation. Inspection means you visually look at your breast. Palpation means you feel with your hands. So when you are looking at your breast, stand in front of a mirror, fully undressed till your waist, and look at both the breasts, whether they are in the similar size and shape. Of course, there can be mild discrepancy for some women in the size, but if you observe it over time, you can observe the changes. Is there any visible bump, lump, nipple discharge, nipple retraction? Is there any persistent redness or swelling within the breast or armpits? So then you can repeat the same examination with arms raised over your shoulder. And then you can lie down and check your left breast with the right hand and right breast with left hand with the flat of your fingers. You can roll and see if there's any lump, if there's any nipple change, the discharge that is coming out. So this is a very simple technique.
And the lump feels like this.
Yes.
Like this nodule. You can feel it on your palm.
Ma'am, absolutely. So if you find something, don't sit with it by listening to neighboring auntie or your grandmother, because according to them, everything is a milk cyst. It is not so. So please don't self-diagnose and come to a doctor. If you are above 40, please get a regular screening mammography every year at our center. We have an excellent 2D mammography, which and with the reporting is also very important. We have a breast radiologist who can even detect very small, like 3 millimeter cancers. So if you're above 40, mammography. If you're less than 40, ultrasound. So this is in nutshell, what you need to know about breast cancer.
So whatever said and done, yesterday was one of the deadliest day of my life.
Okay.
I told you about this woman that you saw this morning.
Yes, ma'am.
That woman, I delivered her 3 years back. Yeah, she was one of our Mrs. Mom finalists. She has polio apparently, and then we took her forward and she walked the ramp for us, and she supported Indian traditions and ikat fabrics and all that. And she was pregnant at that time. We in fact did a sponsored delivery for her.
They told me.
Yes, she was in touch with me on a regular basis, but then she lost her checkups last 1 year. Now when she came to me with a breast lump, I in fact had fingers crossed. I just wanted it to be some fibroadenoma or cystic disease. But when I examined Ramya, I thought, this is cancer.
Yes.
I asked her to go for an ultrasound, and then they went for an ultrasound.
Yeah, they came with the ultrasound report. And in fact, she, I think, was a kind of mentally prepared already because she met you. And maybe she sensed it from you that she may be having
because
cancers.
I know the sensation of cancers on my hand.
She's just 29 when they brought me the scan.
She has
already.
a 3-year-old in the house. Imagine what women are doing towards themselves.
Correct. So in her, actually, the only risk factor that I have seen is obesity. Many a time patients come and ask me, what did I do wrong that I got this breast cancer? So we are left with no answers. If we follow the books and maybe the scientific literature, the only thing that I find in her is the obesity that she has. But we cannot explain everything by that. I think the numbers are just increasing because of the pollution that is there in our food, in our environment, and maybe our lifestyles. And there are microplastics, there are xenoestrogens, which are actually out of our control.
Even in cosmetics these days. I just scared using cosmetics these days, and I check whether it is made genuinely or not, whether it has got an animal product or it is, all go green, and it is organic all these things matter.
Luckily for her, there is only a lump and it is not spread to the under armpit lymph nodes yet. And if we, I advise her an MRI because she is young, she's just 29. Mammography will not help because the density of the breast is going to be high.
Correct.
So if she comes, and again, as you
and in fact, she breastfed also.
She breastfed and she did everything perfectly.
Yes.
So now they're left with the question, I'm so young and I have followed everything. Even obesity is not too much for her. I think she's overweight. Many a time we don't have a reason, and they have financial issues also. So we advised her for some discount, and hopefully we'll get the report. And
now
we're going to do a biopsy on her.
the next very important thing. She's got 3 sisters in the house.
Yes.
Now, what is the plan for them?
How I would do it, ma'am, now is once we confirm, once the biopsy report comes, so we will do a genetic test on her first. So we will do the hereditary cancer gene panel, and if we detect
what all is there in that panel?
So there are,
as far as I know, BRCA1, BRCA2.
yes, those are high penetrance genes.
Okay.
There are many other like CDH1 and P53 and so many other genes which are high penetrance, moderate penetrance, and low penetrance genes for breast cancer. Not only that,
where are they available?
So we can do in genomic labs. We can actually give the sample in Kim. Most importantly, pre-test counseling. So they need to understand why they are undergoing this test. What if it comes as this positive? What are the implications? Because if she has a daughter, then they will be starting to worry about her even when she's a child. And many times parents start feeling guilty that I have given the child the disease. Yeah. So the pre-test counseling, sometimes we get reports like variant of undetermined significance. So we cannot make head and tail of those.
Because I know her mother. She's, I think, just recently passed away, maybe around 1.5 years for some other reason. She's never had any breast
only
issues.
Grandfather has a sarcoma. So, but that is not a risk factor for breast. That's a sporadic. That is, this happened in her. But now that she's so young, if genetic test comes negative, then we will. There is a slight percentage of higher risk in the other sisters, but we will start surveilling them 10 years before what we would do for others. But if we get some gene positive, then we are going to test others also for that.
All the 3 sisters.
Yeah, and then we start screening right away. And if they test positive,
it's important. It's
very important,
really important. Young women having breast cancer is, though now results of treatment and cure with breast cancer are there, but still that word cancer.
Cancer, yes.
How do you feel with that word cancer? People feel that it's endless.
Many times patients' trauma of just hearing that word out of doctor's mouth is, I see the change in expression when I tell them for the first time. So I understand when I'm interacting with the person on the other side. Some people are okay to take that word. Some people cannot take that word. So I assess that, and then I call it a tumor or I call it a cancer. I sometimes use scientific terminology and then slowly get into those terms, because they have assumed a lot of things about cancer. But fortunately, we have good treatments now. And even in breast cancer, the survival rates have improved significantly. If we treat completely in a good way, we have to look at the subtype and treat completely. So the survival rates have definitely improved a lot.
And there are so many newer treatment options that have come in.
Yes, ma'am.
I hear every day in and day out that this treatment is there. Some monoclonal antibodies, they say. Immunotherapy.
Targeted therapy. And even in hormone therapies, we have new molecules. Injections, we have tablets now. And the long courses have become short courses. And the whole idea of cancer treatment, especially in breast cancer, now has become de-escalation. So we don't have to...
And it's available in India
in India, and very much available in KIMS Kondapur and in Hyderabad.
Yes, I'm so proud I'm a part of this team, because I still know that, my relatives and all, whenever they used to have any kind of cancer, they always used to book a flight to US or UK or some other country like Singapore and Dubai and all those places, go have treatments there. But nowadays,
we have people
from there are coming here for treatment, because our waiting times are almost zero.
Yes.
Today, literally anybody wants any specialist appointment, they get it the very same day in Hyderabad.
Yes, ma'am.
You just have to pull through certain, some requests or somebody known to each other and get them. But we still are so approachable, and
the way we explain, and we have a wonderful team of medical oncologists, radiation and everything. So yeah, we are lucky to be part of that team. And doctors like Shilpi, they identify it very fast. So I have seen patients coming in from peripheries. I don't blame them. Maybe they don't have exposure. Just treating the lump as a fibroadenoma, only for them to realize later that it has been growing. But thankfully, we have doctors who can identify the high-risk lesions and send them right away. And I think we are saving
And it's
many
been
lives because of
years I've understood that any super speciality should be respected.
that. Yes.
And
Thank
when
you, ma'am.
people are there, you should give them the right work.
Yes.
And patients come to us trusting us.
Correct.
The trust
Like
factor
this
is very
patient.
important.
This patient, they as soon as I told them, ma'am, can you please call up Dr. Shilpi and tell her I want to go and talk to her. So the trust that they have in you is indirectly translated to the trust in me. And so I think it's important when patients feel that they're in safe hands, their outcomes are better.
Yes.
Because when they're undergoing the treatment, if we suggest something, those doubts are taken away. If they go to a new person, then they are again assessing the trustworthiness of that person. But when they already have trust in you, we have a translated trust. So they said, call up ma'am, and then I called you up, and so I had the discussion with you, and now hopefully we'll do a biopsy tomorrow, and I think we'll start her treatment in the coming week.
World Cancer Day is coming.
Ma'am.
And I know the hospital is geared up to do some activities for the day. But what, according to you, should be the outlook of people now? Because I see so many, clients. My clients are basically women.
Correct.
And obviously, women come along with their husbands and their family members and all. I don't see a healthy environment at all these days. They have,
in terms of the way
in terms of food, lifestyle, use of gadgets or whatever, they are deep into trouble.
Yeah.
And they think it is life.
Correct.
And they think that they have no options.
Not only breast cancer, ma'am, when you were talking about this deeply into work and all that, I remembered. So 80% of women who come to my OPD, outpatient, I named it as software syndrome.
Yes.
So what is it? What is it is they have breast pain because they constantly use the trapezius muscle. So because of this posture, because of looking into the phone like this, the trapezius is tight. Because of that, the pectoralis is getting loaded, and the muscle pain is referred to the breast. So now they have breast pain.
The problem is here and here,
and patient
it goes to the breast. Yes.
So it is called as a referred pain. Now, sitting in front of the computer, they type breast pain in Google, and Google shows number one thing is breast cancer. They come to me in panic. Such a panic. I call this software syndrome. So this is one thing, the breast pain. The other thing is PCOS, infertility treatment related complications in the breast. Not complications, I would say some sequelae, like cyst formation, ductectasia, pain, all these things. So I think somewhere the inactive lifestyle that we are all adopting. So I think that is, I feel sad for them because especially in our country, we are like hustle more and we don't take care of ourselves. We feel proud of not having time for ourselves. I think it should not be like that. We should take out time for ourselves.
And as women rights, I always say that you should have your own space.
Correct.
If you have your own space, if you have interest for your own health, if you have interest to create something for yourself, whether it is time, whether it is money, whether it is spending on you, whether it is just sitting idle for 10-15 minutes in a day, it's luxury.
Luxury, yes.
And that is what your children will watch, and they would definitely give preference to them.
Yes. Many women I've seen, they feel guilty to take time out for themselves.
So I know that.
There is a cancer, they want to get operated after her children's exams.
Yes.
So please don't do that. There are certain priorities one has to have, and they prioritize their health at last. So I think it should not be like that. It's not healthy. Everyone should focus on.
Yes, the other month, I got a woman who has cervical cancer, and then she wanted to get the cervical cancer operated after her daughter's 10th class exams.
Oh God, okay.
That schedule is March. And where are we? Jan.
Yes.
Imagine she wants to postpone treatment of cervical cancer for 2 months.
Exams.
That's ridiculous.
Yes.
And this is where Indian women are.
Yeah.
She says it's her whole future. I told her, nobody is bothered about 10th class marks right now. You just give your daughter some time and space,
she
and
would
you
recover
give
by then.
Yes, she would recover by then. No, the word cancer itself says that for them, it will take long term as treatment. But surgeries nowadays, we have minimal invasive surgeries.
They go the same day.
Yeah, we have robotic surgery where they go the next day and they can get back to normalcy in a week's time.
Yeah.
But for her to understand that point, because she has her own feed from others.
Correct.
And others told her that if it is cancer, you have to take bed rest for 2 months, who will do and all that. In one single day, she got all that opinion.
So I think sometimes they also have to really listen to us, because they come with a lot of prejudices. So they have heard something.
Old time prejudices.
Old time, from somebody in the family or a neighboring auntie or from Google. And if they go to right information, it is fine. If they go to Google Scholar and read, it is fine. But they go to the wrong places and get wrong information. So they need to have that more trust in the person they're sitting across, and they should prioritize themselves more, I think.
Sometimes I feel that Google should filter what it is trying to give.
Yeah.
Because this unfiltered information is causing so much of trauma. Because by the time they come to us and see in the OPD next day, they're crying all throughout the night.
Yeah.
Today I had
because
a patient.
They imagined something.
Her husband was saying that she had this problem and she Googled and all that. She got whatever differential diagnosis. She was crying the entire day. They came up for a non-emergency situation on an emergency slot at 8:30.
So this reminds me of something very funny. There used to be a cyber clinic in AIMS when I was senior resident for patients who get worried like this looking at Google. On Wednesdays in AIMS, in psychiatry department, there used to be a cyber clinic. So I think that's the need of the hour. It is funny, but for patients, even mastalgia, patients with breast pain, they assume they have cancer and they just come in panic, such panic. They're not interacting well. And it sits in their mind because Google has imprinted something in their minds. So even if we repeatedly tell there is nothing, it takes like about 10 times for them to understand and calm down.
And imagine post-delivered mothers with real milk duct block and a lump. You should imagine their panic.
Yeah, for breast cancer.
They keep crying and crying and crying.
It's a very common condition.
Yes, in them it's a common condition.
Yes.
But you remember that case when we diagnosed a phyllodes?
Yeah, I remember that.
Oh.
So, in fact, you advised her to undergo surgery before the pregnancy. They didn't.
Yes.
And it grew during pregnancy. And after post delivery, because it grew so much that we had to, and it also caused blockage of the milk ducts and everything. We had to operate on her. She's doing well now. It came out as a phyllodes tumor.
Yes, phyllodes tumor.
Yeah. So these things also.
When we advise them at the right time, they never take action at that time. They have all worldly priorities to take care of other than themselves. And when really they are in deep neck responsibilities and soup, at that time, they have to take care of
there's no other
themselves.
option. I wish they can do things earlier.
No, they should schedule their problems whenever they are, rather than at their own pace.
I think like we have in KIMS, there should be a pre-pregnancy checkup. Like they can check their general health, overall health before conception. It can be planned, right? So that way they can be more comfortable during the pregnancy.
Like what we have, cervical cancer vaccine. Is there any time that we're going to have a breast cancer vaccine?
I wish, ma'am, but I don't think it's happening in the near future. Because
actually people come to ask me about breast cancer vaccine.
As you know, cervical cancer is caused by human papilloma virus.
Correct.
So we can have a vaccine for a virus. Here, tumor cells are developing mutations, and there's not a single mutation, a multiple of them. So it's nearly not possible nowadays, at least. If there is something that we can invent, maybe tumor vaccines are possible, but not maybe at least for the next 5-6 years.
It's not single, so that's why it keeps mutating.
Multiple mutations are responsible for breast cancer.
Today, I had, in fact, another patient who's HPV positive. Okay. And then she had some few strains of HPV positive. And she was given a vaccine to HPV after knowing that HPV is positive.
Okay.
I told her, why did you take a vaccine after you know that it is
have
HPV
an infection?
positive?
Yeah. The whole idea of vaccination is to prevent infection. If you already have an infection, it doesn't do anything.
It doesn't do anything.
Yeah.
It will not even help you.
It's not a treatment.
Yeah, you should just do your screening program.
Correct.
So, people overdo things. Overdo things.
Ma'am, I have a question for you. So how do you manage so many things? So I see every time I come to your OPD, there is a line. Everybody, and I see you patiently smiling at everyone. How do you do it? It's a genuine question from my side.
I have to do it. It's important. See, because as you told, lifestyle is the source of all problems, health related. Okay, whether it is physical health, whether it is mental health, whether it is your relationships with people around you. So if you as a center can define yourself to be healthy, happy, and content, be in the moment and live that moment.
Be in the moment.
Yes, be in the moment and live that moment with a smile. You will be healthy because whenever you crib, your cortisol rises. Your cortisol rises, your cortisol will give you a kickback of either BP or sugar. Kickback, you will get obesity. Kickback, you will get depression or you will get some mental health issues. And people around you will suffer along with you. So I always say to myself that if I am going to be good, positive, happy, content, do what I'm doing on a regular basis. I don't do anything on the space. I either talk to patients, either deliver babies, I do laparoscopic surgeries, I do robotic surgeries, I go home, I take care of kids, spend some time with them, I sleep, I do a little bit of shopping, I do groom myself.
A lot of shopping.
Yeah, a
Even
lot of
for us.
shopping. Do groom myself to look good, because anything that is physical, if it is good on the mirror, it'll be good on you.
Yeah.
So my first thing in the morning
Whenever I feel
is
dull,
to look good.
I want to come down to your office because I know number one, there'll be food, healthy food. Number two, looking at you working with such energy actually gives me a lot of energy.
Yes.
There's a lot of positivity in and around you, and looking at the way you carry yourself, it's actually something to learn, definitely.
Because I have so many people around me, you know, whether it is patients, my staff, colleagues.
They all look up to you.
Yes, and my children.
But sometimes can be pressure also, right? No, it doesn't?
It doesn't be a pressure because it's my day-to-day life. So what I think is, once I get up in the morning, I don't think, oh my God, it's a day. No. Let's get up, get ready with the best clothes that I have. And I prefer it to be a new cloth every day. My children say,
one thing about Dr. Shilpi is she doesn't buy one or two. She buys 50 and 100 for all of us. So
because see, wherever there is a frame of affordability, you spend, you generate.
Yeah.
You don't spend, you never generate.
Yes.
So
the heart to give. That I think you have that.
Yes. And I want a new dress every day.
Wonderful.
New sari every day. And I look for that moment. And once I get up, if I am lazy, scrubs. Chalo, let's go in scrubs.
Even those are colorful.
Yes, colorful scrubs.
I think the latest trends and scrubs are on you.
Yes. And on the scrubs, I prefer wearing some coats.
Yes.
Whether it is some, ikat coat or some tie and dye coat or some other thing. Just in
the
fashion.
one that we have recently.
Yes, the long coats.
The long coats.
Winter ones.
Yeah, the in and out.
Yes.
You can wear it in and out.
Indu bindu.
With your Indu bindu. With your glass of drink that you have.
Yes.
That you prepare by yourself. It's wonderful. Actually, nice to see you. Like
so the day starts good. I reach hospital and I'm into that loop again. So if I am cheerful, if I am happy, I keep everybody happy around me. So I prefer to be happy. And even at the end of the day, I have to go home. So I cannot carry my hospital baggage, hospital, picture and all to my home. Because there again, I have sensitive souls. 3 kids, elders in the house. Sometimes I do scream because when I'm tired, that tiredness kills me. But most of the time, I try to be cheerful. Yeah,
whenever I have seen you till now, you're always well dressed, in cheerful mood and full of energy. And other good thing is you don't miss anything. If some event is happening in the hospital, small or big, you're always there to support. That's wonderful, ma'am.
Because I want to make memories. Ramya, memories are everything.
అన్ని బాగున్నప్పుడు మనం బాగానే ఉంటాం మేడం. వాట్ అబౌట్ యువర్ బ్యాడ్ డేస్? ఆ రోజు మీకు ఎక్కడి నుంచి స్ట్రెంత్ వస్తుంది? బికాస్ ఐ హావ్ సీన్ సమ్ టైమ్స్ మనం అన్ని చేసినా కూడా కొన్నిసార్లు పేషెంట్ కండిషన్ వల్ల అవ్వచ్చు, ఆ సిచ్యుయేషన్ వల్ల అవ్వచ్చు, థింగ్స్ మే గో బ్యాడ్. సో ఆ రోజు మీకు ఎక్కడి నుంచి ధైర్యం వస్తుంది?
బ్యాడ్ డేస్ ఆర్ ఆల్వేస్ దేర్. ఆబ్స్టెట్రిక్స్ అన్న తర్వాత బ్యాడ్ డేస్ లేకుండా ఉండవు. We are in a super specialty hospital where we have day in and day out risky patients. When we are lucky, when the treatment is going on, when everything is going on, everything is fine. But there are high risk situations, liver failure in pregnancy, VBACs, when suddenly the uterus ruptures and the baby's life is at risk, mother's life is at risk. At that point in time, patients also become very tough.
అవును.
Because they know it's a VBAC. They know that it can go wrong. They know the responsibility is there on their shoulder.
ఎక్స్ప్లెయిన్ చేస్తాం కూడా.
Yes, everything. Anni chaptamu. Everything we tell them. To tell whether the scar pain is there, it's their responsibility. To monitor mother's parameters, pulse, baby heartbeat, it's our responsibility. Even then, VBAC at times, when the uterus ruptures, it is because of the lady's previous surgery.
అవును,
it opens up.
అవును.
If there is a weak point.
అంటే ఆల్రెడీ తెలిసే ఆ చాయిస్ తీసుకున్నారు కదా వాళ్ళు. మనం అన్ని ఎక్స్ప్లెయిన్ చేస్తాం కూడా.
And if luck is not good, the baby might have a problem. The mother, okay, we have blood bank in the hospital, everything possible we can do to save the mother. We can minute lo run out. Minutes the anesthetic comes and we deliver and all. But sometimes the baby is at risk. At that time, for the next 1 week, it's almost hell in the hospital.
Yeah.
You come, there are people, we have to explain
lot of
them.
people.
New people come at that time.
Yeah.
Because nowadays, VBAC kada. So VBAC means it's a new concept. And the patients choose, the husband chooses. But when delivery happens, parents come, grandparents come, relatives come, uncles come, aunts come, siblings come. Everybody we have to answer. They keep asking you, why did you do? Why did you do? Why did you do? We are in a super specialty setup. If we don't do, who else will do?
అంటే వాళ్ళకి అది కావాలి and it's possible to do.
They want it, but they don't want the risk.
Possibility that it can go well also. So
and
ఆ risk అని explain చేసే మనం చేస్తాం.
And they come with such big tumors, big fibroids, 30 weeks, 25 centimeters of uterus size, 5 grams hemoglobin, 4 grams hemoglobin. Imagine, will there not be any complication?
Yeah.
The urine tubes ekkada untayi itla lagesi. The urine tubes are just towards one corner.
Yeah.
And there can be, trauma that can happen to the ureters, the trauma that can happen, endometriosis to the bowel. There are complications, but they don't want to accept this complications.
God or devil phenomenon. అంటే ఒక పర్సన్ ని, అంటే డాక్టర్ సేమ్ పర్సన్ మనం మాట్లాడినప్పుడు ఎవ్రీథింగ్ గోస్ వెల్, వాళ్ళు గాడ్ అయిపోతారు.
ఎగ్జాక్ట్లీ.
ఒకవేళ వాళ్ళు అదే చేసిన ఏదైనా కాంప్లికేషన్ వస్తే డెవిల్ అయిపోతారు. ఆ మైండ్ సెట్ లో నుంచి పేషెంట్స్ అన్న వాళ్ళు బయటికి రావాలి. వీఆర్ ఆల్సో హ్యూమన్స్. నేను ఎట్లా చెప్తానంటే వాళ్ళకి, మీలాగే మేము కూడా, నాకు బ్యాంక్ లో పని ఉంటే నేను మీ దగ్గరికే వస్తాను. నేను ఈ చైర్ లో కూర్చుంటా, మీరు ఆ చైర్ లో కూర్చుంటారు. సో సిమిలర్లీ ఐ స్టడీడ్ దిస్, సో ఐఎమ్ సిట్టింగ్ ఆన్ దిస్ సైడ్. వీఆర్ హియర్ టు హెల్ప్ యూ. ఇంటెన్షనల్ గా మన ఇంటెన్షన్స్ ఎప్పుడు బెస్టే ఉంటాయి. డాక్టర్స్ అన్న వాళ్ళు వి ఆల్వేస్ డూ అవర్ బెస్ట్. అండ్ గాడ్ డెవిల్ ఫినామినా నుంచి బయటకు వచ్చి ఆ మధ్య బ్యాలెన్స్ లో ఉండాలి. అండ్ వెన్ దే షుడ్ యాక్చువల్లీ పే అటెన్షన్ టు వాట్ వీఆర్ టెల్లింగ్. అప్పుడు ఏం కాదులే అన్నట్టు తలుపు తర్వాత
patients always thinks that I will not face this.
Correct.
I am in a big hospital, I am with a big doctor, they have a big team. Whatever happens to me will be managed.
Correct.
But it's not always.
Yeah.
There will be one situation. Yes, there will be one situation where things can go wrong.
Like I told you about the thyroid case.
Yes,
right?
yes.
So every thyroid case that I do, I meticulously identify the nerve, parathyroids, preserve
the one that gives voice.
So అవన్నీ చేసినా కూడా ఒకసారి ఒక పేషెంట్ కి, అంటే I would have been a part of at least 1,500 thyroid surgeries. So 1 or 2 cases I would have seen having such complications. But అది జరిగినప్పుడు పేషెంట్స్, మరి మీరు ఆ వీడియోలో అలా చెప్పారు కదా అని అడిగారు. అంటే ఇన్స్టాగ్రామ్ రీల్ అలా చెప్పారు కదా అంటే,
that means in Instagram reel, if you say that there will be no voice loss after thyroid surgery, it should apply for all surgeries.
అలా ఉండదు. బట్ 1000 cases లో 999 కేసులకి అవ్వకపోవచ్చు, ఒకళ్ళకి అవ్వచ్చు. అండ్ సో
they should have patience.
Correct. And a patient ki malli after the operation was over, within 3 weeks definitely we are seeing improvement and they're doing well. But meanwhile ఆ 1 week already as a surgeon చేసినప్పుడు మనకి ఒక విషయం అర్థం కాదు, కరెక్ట్ గా చేసాం కదా, what might have gone wrong, and we are also thinking on one side.
Swelling also happens.
Yeah. And అది లాంగ్ స్టాండింగ్ goiter, అంటే చెస్ట్ లోపలికి వెళ్తుంది, చాలా పెద్దగా ఉంది, అండ్ షీఈ్ రికవరింగ్ ఆల్సో. సో యాజ్ అ సర్జన్ నాకు ఆ 10th 1 week 10 days అప్పుడు వాళ్ళు వచ్చి దిస్ గాడ్ ఆర్ డెవిల్ ఫినామినన్ జరిగినప్పుడు నాకు ఐ వాజ్ డిస్హార్టెండ్. అంటే అరే,
they put a blame game. They follow you. They ask questions in the corridors. One while getting into the car.
One at the OPD, one in the ward, and there is no need to do all that. Manam kuda conscientist people, skillfully trained and doing so many things very well. I think this god and devil phenomenon should not be there.
No, I face, even if it is once in 6 months, it will take away your energy for almost 15-20 days to get back to normal,
Yes.
thinking that why this has happened and how the same couple or same person was so different to me at that
Correct.
time and different to me now. Answering ourselves is
అంటే
tremendously
మీరు
stressful.
తప్పు చేశారు కాబట్టి ఇలా జరిగింది అన్న మైండ్ లోకి వెళ్ళిపోతారు వాళ్ళు. అది కాదు. సమ్ టైమ్స్ దెర్ ఆర్ థింగ్స్ దట్ యాజ్ హ్యూమన్స్ వీ కాంట్ కంట్రోల్. సో ఆ ఫ్యాక్టర్ వాళ్ళకి చెప్పినా కూడా ముందు వాళ్ళు అది క్యాచ్ చేయరు. సో ఆ మన రోడ్ మీద సరిగ్గా నడుస్తున్నాము, మనం సరిగ్గా నడిచినంత మాత్రం మనకి యాక్సిడెంట్ అవ్వదని ఉండదు
There's
కదా.
other person who can come and hit you.
హిట్ యూ. సిమిలర్లీ సర్జికల్ ఫ్యాక్టర్స్ లో చాలా మంది చేతుల్లో ఉండవు. ఆ ఫ్యాక్టర్ ఒకవేళ జరిగిన తర్వాత కూడా మనం దాన్ని ఎట్లా పేషెంట్ ని బయటకు తీసుకురావాలన్న మైండ్ సెట్ లో ఉంటుంటే, వెన్ దే కమ్ అండ్ అటాక్ అస్ లైక్ దిస్, డిఫెన్సివ్ మోడ్ లోకి వెళ్ళిపోతాం మనం.
I
సో
know.
అది ఐ థింక్ దే షుడ్ నాట్ డూ దట్. దోస్ ఆర్ ద బ్యాడ్ డేస్. బట్ మిమ్మల్ని చూసి నేర్చుకోవాలి. నేనైతే మాత్రం ఐ వాజ్ రియలీ షుక్.
No, I have to be the face of my department, so I cannot, show my, draining of my energy and all that, because people look up to me. I have to be well versed with all such situations. And 25 ఏళ్ళ నుంచి ప్రాక్టీస్ చేస్తున్నాను కదా, ఊర్లలో ప్రాక్టీస్ చేసాము, అక్కడే అన్ఎడ్యుకేటెడ్ పీపుల్ ఉంటారు, దే బికమ్ వెరీ రఫ్ ఆల్సో ఎట్ టైమ్స్. ఐ హావ్ సీన్ ఆల్ దట్. సో ఫర్ మీ, managing all such situations is an integral part of saving yourself as a person. Because if we don't save ourselves, what bloody are we going to save others?
మన లోపల ఉన్న ఆ ఎనర్జీ ఉంటుంది చూసారా, అది డ్రైన్ అయిపోతుంది. ఎందుకు చేస్తాను ఇంత కష్టపడి నేను? బికాస్ మనం చేసిన 1000 సర్జరీలు 999 సక్సెస్ అయ్యాయి. అండ్ మంచిగా రాశారు, స్వీట్స్ తెచ్చిస్తున్నారు, చీరలు పెడుతున్నారు. ఆల్ దట్ ఈస్ హ్యాపెనింగ్. బట్ దట్ వన్ పేషెంట్ who they blame us for that kind of
and nowadays since everything is online, they keep attacking you online also. And they put so much of nonsense online. And since Google reviews, abba Ramya, Google reviews చూడాలి. ఇంట్లో పెళ్ళంతో గొడవ పడినా కానీ వాడు Google review పెడతాడు. And Google reviews never on the doctor. Okay, it is a perception of their experience. And experience అంటే ఏంటి? నీ ఆలోచనలో నీ ఊహల్లో.
అవును.
ఓకే, నీ ఊహల్లో నువ్వు ఇలా ఊహించుకున్నావు, అది అలా జరగలేదు. లేకపోతే డాక్టర్స్ ఏమే, ఈ పేషెంట్ అలా చూస్తాము, నిన్ను చూస్తాము, అందరిని అలాగే చూస్తాము, మా పనే అది. అండ్ ఎంత ఇలాబొరేట్ గా పెడతారంటే అప్పుడప్పుడు గూగుల్ రివ్యూస్.
నేను అపాయింట్మెంట్ 10 o'clock తీసుకున్నాను, కానీ డాక్టర్ నన్ను 11 o'clock చూసారు. ఎందుకు? ఆపరేషన్ జరుగుతుంది. సో ఫస్ట్ సర్జరీ వేరే వాళ్ళు చేసిన డిలే అయింది అనుకుందాం అనుకోండి. డిలే అవుతాయి. వి కెనాట్ సమ్ టైమ్స్ అది అర్థం చేసుకోవాలి. సో యా, ఐ థింక్ దట్ పార్ట్ ఫ్రమ్ పేషెంట్స్ షుడ్ చేంజ్.
డాక్టర్ ని కూడా మెటీరియల్ లాగా చూస్తే ఎంత బాధేస్తుంది తెలుసా? అందుకే తెలుసా, లాస్ట్ కొన్ని సంవత్సరాలుగా నా డోర్ ఓపెన్ ఉంటుంది. ఎందుకంటే నేను మాట్లాడుతున్నాను, నేను కష్టపడుతున్నాను, నేను ఒక్కో పేషెంట్ ని చూస్తున్నాను. నువ్వు బయట ఉన్నప్పుడు, నువ్వు వెయిట్ చేస్తున్నప్పుడు, నువ్వు అది నీకు ఒక నెగటివ్ గా కనిపించొద్దు. నేనేమన్నా తింటున్నానా, లేకపోతే నేనేమన్నా లగ్జరీలో ఉన్నానా, లేకపోతే ఇంకేమన్నా చేస్తున్నానా? లేదు. ఐ ఆమ్ సీయింగ్ పేషెంట్స్. అండ్ ఒక పేషెంట్ కి కొంతమందికి 2 నిమిషాల్లో అయిపోద్ది. అంతే కదా. ఇప్పుడు నీ ఒక రిపోర్ట్ తీసుకొచ్చావు, ఈ రిపోర్ట్ నార్మల్, ఏం కంగారు పడకు, ఇంటికెళ్ళు, రాసిని ఫాలో చెయ్యి. ఇది చెప్పడానికి ఎంత టైం పడుతుంది చెప్పు? నిమిషం కూడా పట్టదు. నేను చాలా సేపటి నుంచి వెయిట్ చేశాను, నాకు మేడం 1 నిమిషం మాట్లాడింది. ఆ 1 minute చాలు నీ గురించి నీకు చెప్పడానికి. మనం సోదేయడానికి, హస్కేసుకోవడానికి అక్కడ ఏమీ లేదు బేసిక్ గా. అండ్ we are not friends to sit down and talk everything on this earth.
ఎస్పెషల్లీ అదొకటి ఫ్యాక్టర్ నేను చూసాను. అంటే మనం ఎక్కువ చాటీగా అవ్వలేం. we need to control the time that we are giving. And అదే పేషెంట్ వేరే వాళ్ళకి టైం ఎక్కువ ఇస్తుంటే ఇంతసేపు చూస్తున్నారు ఏంటి అంటారు.
మేబీ దట్స్ ద ఫస్ట్ పేషెంట్.
వాళ్ళ టర్న్ వచ్చినప్పుడు ఫస్ట్ టైం వచ్చే పేషెంట్, వాళ్ళ టర్న్ వచ్చినప్పుడు ఇంత తొందరగా పంపించేశారు ఏంటి. సో ఇట్లాంటివి చూస్తూ ఉంటాం కదా మనం. ఇట్స్ బిట్ ఆఫ్
బట్ నాకు అనిపిస్తుంది, డాక్టర్స్ we are judged every day,
every move
that we make, every time we are judged. Our decisions are judged. ఏమి సెకండ్ ఒపీనియన్, థర్డ్ ఒపీనియన్ లకి వెళ్తానే ఉంటారు. అది నడుస్తూనే ఉంటది. మనని జడ్జింగ్ నడుస్తూనే ఉంటది, రివ్యూస్ నడుస్తూనే ఉంటది. వాట్ పీపుల్ డోంట్ కాన్సన్ట్రేట్ ఇస్ ఆన్ దేర్ హెల్త్.
అవునండి. మీ సెకండ్ ఒపీనియన్ నాకు గుర్తొస్తుంది. ఐ హ్యావ్ దిస్ వెరీ టిపికల్ ప్యాటర్న్ ఆఫ్ హౌ యుఎస్ పేరెంట్స్ వస్తారు మా దగ్గరికి, పెద్దవాళ్ళు వస్తారు. సో దే మస్ట్ బి ఇన్ దేర్ 70s 80s పేరెంట్స్ వస్తారు, పిల్లలందరూ యుఎస్ లో ఉంటారు. సో టిపికల్ గా వీళ్ళు ఏంటంటే మదర్ ఫాదర్ వచ్చి కలుస్తారు కదా, వాళ్ళకి క్యాన్సర్ ఉందనుకోండి. సో మా మా పిఎంఎం టీమ్ అంతా కలిసి వి ట్రై టు హెల్ప్ దెమ్, అంటే లాజిస్టిక్ గా చాలా సపోర్ట్ చేసి
Exactly. There's nobody to take care of them.
టెస్ట్లన్నీ
Yeah.
చేయించి వాళ్ళ నైట్ వాళ్ళ 12 hours గ్యాప్ ని కోఆర్డినేట్ చేసుకుని నా పర్సనల్ నంబర్ ఇచ్చి ఫోన్ లో అంతా మాట్లాడతామా. వన్స్ దే కమ్ టు ఇండియా హియర్, మెనీ టైమ్స్ వాళ్ళు ఒక్కసారి కలవడానికి కూడా రారు. అక్కడి నుంచి కనీసం ఫోన్
Because అప్పటికి అవసరం అయిపోద్దిగా.
అవసరం అయిపోతుంది. సో యూ గో ఫర్ సెకండ్ ఒపీనియన్స్, వి ఎంకరేజ్ సెకండ్ ఒపీనియన్స్.
Yes.
బట్ ప్లీజ్ అండర్స్టాండ్ దట్ ద పర్సన్ హూ హెస్ బీన్ హెల్పింగ్ యూ ఆన్ ద అదర్ సైడ్ ఇస్ ఆల్సో హ్యూమన్ బీయింగ్. ఒక బేసిక్ మేనర్స్ ఏంటంటే వాళ్ళకి కమ్యూనికేట్ చేసి చెప్పండి, మేము వస్తున్నాము, రావట్లేదు. సేమ్ థింగ్ దే డూ టు అదర్ డాక్టర్స్ ఆల్సో. దే మైట్ have consulted somewhere else, they come to me. I definitely ask them, have you communicated this to the other doctor? Because all of us, most of us are trained
on a friendly
very well
platform,
on a
yes.
friendly platform. మీరు ఒక డాక్టర్ గురించి ఇంకో డాక్టర్ దగ్గర చెడుగా మాట్లాడినంత మాత్రం మేము వెళ్ళి డిస్కస్ చేసుకుంటాం అవి. ఐ మీన్ ఒక సిటీలో ఉన్నామంటే వి నో ఈచ్ ఎవ్రీబడి ఎల్స్,
We're in the same forum.
అండ్ ఎవరు ఆ కమ్యూనికేషన్ బేసిక్ మేనర్స్ అనేవి మర్చిపోకూడదు. యాక్చువల్లీ అవతల పర్సన్ డాక్టర్ కూడా ఒక హ్యూమన్ బీయింగ్, వీళ్ళు ఎఫెక్ట్ అవుతారు, వీళ్ళకి చెప్పాలి మేడం మేము రావట్లేదు, ఆర్ మేము ఇక్కడికి వెళ్తున్నాము, ఆర్ నా దగ్గరికి వచ్చినప్పుడు ఆ డాక్టర్ దగ్గరికి సారీ అండి మేము ఇలా డాక్టర్ రమ్య దగ్గరికి వచ్చాము
లేదు రమ్య,
చెప్పాలి.
ఇప్పుడు హెల్త్ కేర్ ఇస్ ఆల్సో బికమ్ షాపింగ్. బికాస్ సి ఇన్ అదర్ కంట్రీస్ నేను మార్నింగ్ 1 hour అండ్ ఈవినింగ్ 1 hour అవుట్ సైడ్ కంట్రీ పేషెంట్స్ కి అపాయింట్మెంట్స్ తీసుకుంటాను. అక్కడ వాళ్ళకి ఒక డాక్టర్ అపాయింట్మెంట్ దొరకడానికి ఈవెన్ ఇన్ యుఎస్, యూకే, ఆస్ట్రేలియా, ఎనీవేర్ 2-3 months వెయిటింగ్ ఉంటుంది. 2-3 months లో కూడా దొరకపోతుండొచ్చు. దే వోంట్ గెట్. ఇన్ యూకే అయితే అసలు అది కూడా దొరకదు,
ఎన్హెచ్ఎస్ కాబట్టి.
ఇంత టైట్ సిచ్యువేషన్ అక్కడ ఉంటే ఇక్కడ మన దగ్గర పొద్దునో డాక్టర్ సాయంత్రమో డాక్టర్ దగ్గర తీసుకెళ్లి వాళ్ళు చూసుకుని చేసుకుని ఇద్దరు దగ్గర ట్రీట్మెంట్ తీసుకోకుండా గడిబూటి అంటారు చూడు, అలా క్వాక్స్ దగ్గర కూడా వెళ్ళి ట్రీట్మెంట్స్ తీసుకుంటారు. అండ్ దే డోంట్ వాల్యూ మెడికల్ కేర్ ఎట్ ఆల్. బికాస్ ఇఫ్ దే ఆర్ వెరీ సీరియస్ అబౌట్ మెడికల్ కేర్, దే విల్ లుక్ ఇన్ టు ప్రివెంటివ్ స్ట్రాటజీస్.
అవును,
ప్రివెన్షన్ గాలికి వెళ్ళిపోయింది. ఫస్ట్ లైఫ్ స్టైల్లో ఉంటారు. ప్రాబ్లం వస్తే మట్టుకు డాక్టర్ 100% కేర్ ఇచ్చేయాలి, అర్జెంట్ గా ట్రీట్మెంట్ అయిపోవాలి.
ఇచ్చినా కూడా కొన్నిసార్లు మన చేతిలో ఉండదు.
ఎక్కడ రమ్య పీసీఓడి ఉందా? ఆ పీసీఓడి 10 రోజుల్లో ట్రీట్మెంట్ ఉంటుందా చెప్పు? 10 నెలల్లో కూడా ఉండదు. 10 months also,
and most
the patient will not
their hands.
feel. Yeah, it's in their hands. And in terms of discipline of eating food, no. Of sleeping on time, absolutely no. At least stress management, super stressed out all the time. Medicines will you take? These medicines will have side effects, so I will not take. So how the hell will PCO come into control? And with PCO comes obesity. With PCO comes breast cancer. With
it's
PCO
a vicious circle.
Yes, wherever there is obesity, there are so many cancers coming in. They are just not
sedentary
understanding.
lifestyle, no exercise, obesity, PCOS, all this infertility, and
to the most thing that I can't stop laughing. Doctor, do I have PCOD or PCOS? The word doesn't change anything. You have a complex problem that needs so many changes.
Yeah.
It is not important what you have PCOD or PCOS. It is important that discipline needs to be in all corners. It's so difficult.
మన ఓవర్ నైట్ చేంజ్ చేయగలిగిన కాదు, అండ్ మోస్ట్ ఆఫ్ ద థింగ్స్ ఆర్ ఇన్ దేర్ హ్యాండ్స్. వాళ్ళు అలా డిసిప్లిన్ అంటే నేను అప్పుడు ఏం చెప్తానంటే వాళ్ళకి దేర్ ఆర్ సమ్ మోడిఫైబుల్ ఫ్యాక్టర్స్, దేర్ ఆర్ నాన్ మోడిఫైబుల్ ఫ్యాక్టర్స్. మీ చేతుల్లో ఉన్నది మీరు స్టార్ట్ చేయండి, థింగ్స్ దెన్ విల్ స్టార్ట్ చేంజింగ్. అన్ని
50%, 5-10% కాదు, 50% is in their court. Rest 50% as treatment, we will definitely help them out. They will never. And ఇప్పుడు
గ్యారంటీలు కావాలి. గ్యారంటీ
100%
గ్యారంటీ ఇస్తారా? ఆయన ఇస్తాడు గ్యారంటీ. సో
అండ్ ఇప్పుడు వరల్డ్ క్యాన్సర్ డే ఇస్ కమింగ్. మనం ఈ రోజు ఎన్ని పోస్టర్స్ చేశారు హాస్పిటల్లో. వి సా సిరీస్ ఆఫ్ పోస్టర్స్ కదా.
Everybody participated. Doctors.
Yes.
I was, in fact, senior most cardiologist. He took out time.
Yes.
And chinna pharmacy pillalu.
And you remember the tagline?
Yeah.
This is
just a chapter in your life. But
cancer is a chapter in your life.
But not the end of life.
It's not the complete story.
Yes, not the complete story.
So, for everybody out there, if you're having any health issues, whether it
Mm.
is cancer or anything else, it is only a small chapter of your life, and it's not your entire story. The book has a big story,
Mm.
and people stop their lives for that.
Mm.
You shouldn't. And wherever possible, look into preventive strategies.
అవును మ్యామ్.
And మనం ఇన్ని ఈవెంట్స్ చేస్తాం ఆ ప్రివెంటివ్ స్ట్రాటజీస్ కి, వింటారు మర్చిపోతారు. And we don't know really people will become serious about things or they will not become serious
మనం
about
ఏంటంటే
things.
డెంటల్ ప్రాబ్లం వచ్చే వరకు డెంటిస్ట్ దగ్గరికి వెళ్ళాం.
I know.
సో
But at least brush చేస్తాం
బ్రష్
కదా.
చేస్తాము. యా లక్కీలీ ఫర్ అస్. అండ్ ఐ థింక్ దట్ షుడ్ చేంజ్ సమ్వేర్. అప్పుడే మనకి అవుట్కమ్స్ బెటర్ గా ఉంటాయి. అండ్ ఆఫ్ కోర్స్ డయాగ్నోస్ వచ్చినంత మాత్రం జస్ట్ రిపేర్, వీ హావ్ టు గెట్ ద థింగ్. కార్ రిపేర్ చేయించుకుని ఎట్లా నడిపిస్తాము అలా
సర్వీసింగ్ వెళ్తాం కదా రమ్య,
వెళ్ళాలి.
కార్ సర్వీసింగ్ వెళ్తారు 10,000 కిలోమీటర్లకి, కార్ సర్వీసింగ్ చేస్తారు, వైఫ్ కి సర్వీసింగ్ చేయించరు అంతే.
అవును.
సో
అండ్ హెల్త్ చెకప్, ఇప్పుడు సమ్ టైమ్స్ ఇంకోటి ఏంటంటే ప్రాబ్లమ్, హెల్త్ చెకప్ చేస్తాము, దాంట్లో ఏదో తెలుస్తుంది. సో దాన్ని ఫర్దర్ గా వర్కప్ చేయించుకోవాలంటే కూడా రెసిస్టెన్స్ వస్తుంది. నేను టెస్ట్ చేయించుకున్నా, నాకు ఈ విషయం తెలుస్తుంది, తెలుసుకోవాలనే మనం చేయించుకున్నాం.
అంతే. అన్ని రిపోర్ట్స్ మంచిగా రావడం, ఇంకా టెస్ట్ ఎందుకు?
కరెక్ట్, వస్తే మంచిదే. ఒకవేళ ఏదైనా ప్రాబ్లం ఉంటే దాన్ని
ప్రాబ్లం
చేయడానికి కాబట్టే కదా మనం చేసాము.
ప్రాబ్లం ఐడెంటిఫై చేయడానికి.
అరే మ్యామ్, దట్ రిమైండ్స్ మీ, 2 years బ్యాక్, ఇన్ఫాక్ట్ 3 years బ్యాక్, నేను కిమ్స్ కి అప్పుడే వచ్చినప్పుడు ఫ్రమ్ ద అదర్ హాస్పిటల్ దట్ ఐ వాస్ వర్కింగ్, దెర్ వాజ్ అ లేడీ హూ అండర్వెంట్ mammography the last year. She was written in the report to have a cancer. She was advised to meet the doctor. In that report clearly written.
వాళ్ళు తీసుకొచ్చి
వాళ్ళు
చూపిస్తే కదా.
కలవలేదు డాక్టర్ ని, అలా వెళ్ళిపోయారు.
అంతే.
ప్రాంప్ట్ గా నెక్స్ట్ ఇయర్ హెల్త్ చెకప్ కి వచ్చారు. అప్పుడు 1.2 సెంటీమీటర్స్ ఉన్న క్యాన్సర్ కాస్త ఇప్పుడు 3 సెంటీమీటర్స్ అయింది. చేతికి తగులుతుంది, అయినా పెద్దవాడు చెప్పలేదు ఇంట్లో. సో ఇప్పుడు చూస్తే లక్కీలీ షీఈ్ నౌ డూయింగ్ వెల్. బట్ ఇలా కూడా ఉంటుంది, మన స్కాన్ సెంటర్ లో స్కాన్ చేయించేసుకుని ఆ రిపోర్ట్ చదివేసుకుని గూగుల్ అడిగేసుకొని, గూగుల్ అడిగినా చెప్పేదేమో గూగుల్, దే డిడ్ంట్ పే అటెన్షన్ టు ద రిపోర్ట్. మిగతా బీపీ షుగర్ అని చూసుకుని వెళ్తారు.
We see a lot of times వాళ్ళు కంపెనీస్ లో స్క్రీనింగ్ టెస్ట్ చేస్తారు కదా, ఫ్రీ స్క్రీనింగ్ టెస్ట్లు అనేసి ఒక కట్ట.
అవును,
మనం రాస్తేనేమో ఓన్లీ థైరాయిడ్, ప్రొలాక్టినో, లేకపోతే ఏఎంహెచ్ఓ, హెచ్బిఏవన్సీ 4 టెస్టులు ఫోకస్డ్ గా రాస్తాము. ఆ 4 టెస్టులు, ఆ 40 టెస్టులను మనం వెతుక్కోవాలి.
అవును,
అవన్నీ చేయించుకుంటారా, చేయించుకుని మన దగ్గరకు వస్తే మనం అన్ని చెక్ చేస్తాం. చాలా సార్లు చెక్ చేయరు,
వాళ్ళే చూసుకుంటారో లేదో కూడా తెలియదు.
రెఫరెన్స్ రేంజెస్ డార్క్ కలర్ లో ఉంటాయి కదా, అవి కూడా గమనించుకోరు.
చేయించుకుని టిక్ మార్క్ కొట్టుకుంటారు అంతే.
అంతే, టెస్ట్ డన్, నాట్ షోన్ టు ద డాక్టర్.
బట్ ఇది బ్రెస్ట్ మాత్రం ఇట్ వాస్ అ వెరీ రిస్కీ థింగ్ ఫర్ హర్, బికాస్
ఎగ్జాక్ట్లీ
అందులో రాసింది కూడా క్లియర్ గా, హై రిస్క్ బెరాట్స్ 5 లీషన్ టు ప్లీజ్ కన్సల్ట్ బ్రెస్ట్ స్పెషలిస్ట్ అని రాసింది క్లియర్ గా దాంట్లో.
మోస్ట్ ఆఫ్ ద టైం నేను చెప్తున్నాను కదా, మన దగ్గర స్క్రీనింగ్ వస్తారా పాప్స్మియర్ కి, ఆఫ్టర్ పాప్స్మియర్ ఇస్ డన్ they don't come and show us the report, because entire all reports come the next day or the next day. So all blood reports come in the evening.
Avunu.
Mammographic report comes in the next day.
Yeah.
Pap smear comes after 4 days.
4 days. Chudali, pathologist chudali.
After 4 days, either they are traveling, or either there's a festival, or either there's a function, and they just forget.
Or they have an office work.
Yes, they just forget about it, and they don't come for follow-up. Now, when they don't come for follow-up, that report, even if it is wrong or it is indicating a problem,
సార్లు మామోగ్రఫీలో అబ్నార్మాలిటీ ఉంటే నాకు రేడియాలజిస్ట్ ఫోన్ చేసి చెప్తే, నేను పేషెంట్స్ కి ఫోన్ చేయించి, మీరు వారం అయింది ఎందుకు రాలేదండి అని ఫోన్ చేయించి పిలిపిస్తాం. యాక్చువల్లీ
that happens
many times.
Yeah, I think that protocol has started, I think 1 or 2 years right now, that if there is any problem, there's a call from the lab. They call us. Even ketones are positive, or somebody with hyperemesis, a call comes. Hemoglobin less, a call comes. Any viral markers positive, a call comes. So that we follow up and we ask them to come.
Yeah.
But it happens in our hospital. Imagine if they get it down outside.
బయట ఎక్కడని చేస్తే
gone. Why would that lab call?
ఎక్కడ చేస్తున్న టెస్ట్ అనేది కూడా చాలా ఇంపార్టెంట్ మేడం.
Exactly.
వీళ్ళు తక్కువ అవుతుంది కదా అని చెప్పి అన్స్టాండర్డ్ ల్యాబ్స్, ఎన్ఏబిఎల్ అక్రెడిటేషన్ లేని ల్యాబ్స్ చేశారనుకోండి, వి కెనాట్ డూ ట్రీట్మెంట్ బేస్డ్ ఆన్ దోస్ రిపోర్ట్స్. చాలా సార్లు మనం రిపీట్ చేయాల్సి వస్తుంది, చేసి వేస్ట్ అవుతుంది. బెటర్ టు డూ ఫ్రమ్ గుడ్ ల్యాబ్స్. అదొక పాయింట్ కూడా నేను పేషెంట్ చెప్తూ ఉంటాను, ఎస్పెషల్లీ సర్టన్ టెస్ట్.
As the doctor matters, so does
lab matters,
investigation
reporting
matters.
Doctors matter.
Exactly. See, there are freshers who come with very low experience. If they are going for an hourly basis to a local lab to report, what justice are they going to do to the
Correct.
patients? And when we have recruited 10 years, 15 years seniors for
Well-trained.
reporting, well trained,
Who gave enough time.
and
And who
volumes
can
handle
discuss with
చేసేవాళ్ళు.
the clinician. ఆ
Exactly.
డైలాగ్ అవుతుంది కదా, అది చాలా
Exactly.
ఇంపార్టెంట్.
What we need to see, we'll tell them. What they have seen, they'll discuss with us.
మనం వన్ ఫోన్ కాల్ అవే, మేడం ఇలా అనిపిస్తుంది, వాట్ డూ యూ థింక్, చూసారా ఇది కరెక్ట్ గా, లేదు లేదు రమ్య దిస్ ఇస్ లుకింగ్ లైక్ దిస్ అని అంటే అక్కడికి ఆ ఇన్ఫర్మేషన్ క్లోజ్, డైలాగ్ క్లోజ్ అవుతుంది. అదే ఇక్కడ ల్యాబ్ లో అవుట్ సైడ్ మనం వాళ్ళు రాసిన రిపోర్ట్ మీద, అఫ్ కోర్స్ అంటే నాట్ ఎవ్రీ టైమ్ ఇట్స్ బ్యాడ్ రిపోర్ట్, బట్ సమ్ టైమ్స్ ఇట్ హ్యాపెన్స్. వీ డోంట్ హ్యావ్ కంట్రోల్ ఆన్ దట్. అక్కడ నిజంగా డాక్టర్ చేశారు.
చాలా సార్లు డెన్స్ బ్రెస్ట్ అని చెప్పేసి రిపోర్ట్ ఇచ్చేస్తే డెన్స్ బ్రెస్ట్ ఇస్ నార్మల్ అని చెప్పి వదిలేస్తారు.
అవును.
మన వాళ్ళు ఏం చేస్తారు, నీకు గుర్తుందా,
స్క్రీనింగ్ చేస్తారు.
డెన్స్ బ్రెస్ట్ అయినప్పటికీ గో ఫర్ స్క్రీనింగ్,
అవును,
యునో అల్ట్రాసౌండ్ ఇఫ్ దెర్ ఇస్ ఎనీ.
చాలా సార్లు చేసేస్తారు స్కాన్ వాళ్ళే, చేసేసి దెన్ దే గివ్ ద రిపోర్ట్. సో అది చాలా ఇంపార్టెంట్, అది వాళ్ళకి అర్థం కాదు.
దాట్ ఇస్ క్వాలిటీ. ఎవ్రీబడి లుక్స్ అట్ క్వాలిటీ వెన్ యూఆర్ బయింగ్ క్లోత్స్, వెన్ యూఆర్ బయింగ్ ఫుడ్.
బికాస్ మన దగ్గర ఏంటంటే వీ హ్యావ్ సచ్ గుడ్ ట్రైన్డ్ రేడియాలజిస్ట్ ఆల్సో అండ్ pathologists also that they give such precise reports, and I think that trust is also important for amongst the doctors.
Follow up is so important for treatment and therapy and all that. It's really very important part of a journey for a patient also.
మీ రొటీన్ ఏంటి, మీరు ఏం చేస్తారు అసలు, ఎప్పుడు లేస్తారు, ఏం చేస్తారు, నాకు చాలా క్యూరియాసిటీ. ఎందుకంటే నేను మీ పోస్ట్ చూసినప్పుడు పండగలకి యూ డూ ఎవ్రీథింగ్ అండ్ దెన్ యూఆర్ ట్రావెలింగ్ అండ్ దెన్ యుఎస్ లో ఉంటారు, మళ్ళీ పక్క రోజు ఇక్కడ ఉంటారు. ఐ మీన్ అసలు ఎలా, హౌ డూ యూ డూ ఆల్ దిస్?
So for me, my family is my center. Like how I have two epicenters. One is the hospital and one is my family. I don't work anywhere else. ఈ రెండు places important. And I don't like getting up early in the morning. నేను ఐఎమ్ ఎర్లీ రైజర్ కాదు, చిన్నగా ఉన్నప్పటి నుంచి. I somehow don't like getting up at 5-6 o'clock in the morning. I get up at 7 o'clock. So
Good enough.
My son, both of us get up at 7 o'clock. But if I have to cook for them, వాళ్ళ బాక్స్ ప్యాక్ చేయాలంటే I get up at 6 o'clock so that I cook something special for them.
లేకపోతే ఇంట్లో వేరే వాళ్ళు చూస్తారు.
Yeah, my mother-in-law, she's in charge of that. So she does that. And my mom right next to me untad kabatti, she is also of help in such things. So
lucky us.
Yeah, so I get up at 7 o'clock. Quickly we all get ready, we pack our lunches, we have breakfast, and then I'm off to hospital at the same time like my children. 7:45 they leave to school. 8 o'clock I leave to hospital. My day starts early in the hospital. So hospital ki enduku early vastam, edana OT unte complete chesesukoni rounds labor room lo patients untaru, vallato kasep time spend chesi vaalla strategy chusi kasep dance chesi ad chesi id chesi mana staff andarto kasep maatladi ఇంకా కింద సముద్రం 10 గంటలకు అంత కిందికి వచ్చామంటే మళ్ళీ మధ్యలో ఏదైనా డెలివరీస్ ఉంటే వెళ్ళి రావడం తప్పితే in between we go and come. Otherwise by 4:35 I finish hospital. And after 5 I have these meetings, branding meeting, లేకపోతే మనం నెక్స్ట్ ఏం ఈవెంట్స్ చేస్తున్నాం, the events that we do, the philanthropic activities that I do, my foundation events, even all these things are there. So it's almost 6 and I have patients lined up in the evening. Morning when I'm coming to hospital, while I'm in the car I take online appointments. While evening also when I'm going home.
పాటలు ఎప్పుడైనా వింటారా, మరి రిలాక్స్ ఎప్పుడు అవుతారు?
When there are no appointments. When there are no appointments we do that.
So any మాకు మూవీస్ కి టికెట్లు కావాలంటే మేడం. So that's a nice thing. నేనేంటంటే it's very regular. Sometimes I wake up at around 6, sometimes 7, sometimes 8. కేసెస్ ఉంటే తొందరగా లేస్తాను. As you know, నేను 2 హాస్పిటల్స్ కి వెళ్తాను, కొండాపూర్ అండ్ గచ్చిబౌలి. But predominantly I'm in Kondapur. I also go to Gachibowli because I like to be in 2 places. They are nearby.
You are not dealing with obstetrics. You can be in multiple places.
Luckily for me, my cases are elective. There are no emergencies. And I go there and I most of the time I'm in Kondapur though. And I nowadays I'm making sure that I work out. I spend time with my daughter. I have a 4-year-old daughter. It's అంటే తను పడుకునే టైంకి ఉండాలి, పొద్దున్నే తను స్కూల్లో దింపాలి. ఇవి నాకు బేసిక్ కోరికలు అనమాట. ఇది కాకుండా ఐ లైక్ టు పార్టీ అలాట్, ఫ్రెండ్స్ తో టైం స్పెండ్ చేయడం ఇలా చేస్తా ఉంటాను.
I go home, spend time with family when they're all sleep by 9:30. If there are emergencies I come. If there's a party I go after that. Once in a while only I party. I don't party usually. Movie ante weekend. So this is a routine. ఎందుకంటే సండేస్ కూడా అప్పుడప్పుడు యాక్టివిటీస్ అవి ఉంటాయి. అండ్ వెరెవర్ ఐ గో ఐ టేక్ మై చిల్డ్రన్ అలాంగ్ సో దట్ ఐ స్పెండ్ టైమ్.
Yeah, I've seen that.
Yeah.
I also take my daughter wherever it's possible. She's still young, so some places we cannot take her. But I think that's how we should. Mana balance ఒక రోజులో ఉండదు. I think నా balance 1 week లో ఉంటది. So ఈ రోజు like totally work, tomorrow is totally like with family. అట్లా ఉంటది కానీ I think the balance is over a week, not in the same day.
My day is the same every day.
Maybe I'll get there someday.
అండ్ నైట్స్ లో కూడా డెలివరీస్ అవుతే రావాల్సి వస్తుంది కదా.
అవును, అవును.
సో ఐ ప్రిఫర్ టు
I
స్లీప్
think
ఎర్లీ.
your specialty is like that. So you
Yes.
have lot of unexpected things.
ఐ ప్రిఫర్ టు స్లీప్
మీ
బై
మైండ్ ట్యూన్ అయిపోయి
9:30.
ఉంటుంది కదా వాటన్నిటికి.
యా, సో 9:30 if I shut down, in midnight if there is a call I need to come. So
You don't become grumpy the next
no, because it's again seeing childbirth, no? It's again seeing childbirth, it's taking care of some woman, and
Yeah.
then outcomes. It's part of life. Obstetrician అంటే ఇంకా అలాగని tune up అయిపోవాలి.